Welcome to DPC Pediatrician. We're Dr. Phil Boucher
and Dr. Marina Capella, two DPC pediatricians who are on a mission to share our love of direct primary care with you.
Welcome, everyone. I am delighted to introduce Dr. Drew Hertz and Dr. Keili Mistovich. They are the co-founders of the Zest Pediatric Network in Cleveland, Ohio. At least you started in Cleveland, Ohio. And they're going to talk about their network and what it has to offer in the DPC community. There are a lot of pediatricians who have learned about DPC and have been interested in it, but maybe they have a lot of fear or worries or trepidation about actually doing all of the business and clinical stuff on their own. So Zest Pediatric Network offers a great option for people who maybe don't want to be 100% independent and want to share the load with someone else. So with that, welcome, Drew and Keili. Thank you so much for being here.
Thank you for having us.
Yes, thanks for having us. And you're exactly right. We really created Zest Pediatrics to lower the barrier for people to enter pediatric DPC or pediatric direct care, as we like to call it. And we actually wanted to entitle this session, when you asked us what the title is, it's DPC is a team sport, because not everybody wants to go it alone.
Yeah.
So with that, Keili, I think we have a few slides that you had asked us to prepare. I just kind of give an overview of why we created this network. All right.
Okay, perfect. So I'll start with here and kind of give a general overview of sort of why does Zest exist in the first place, and really what are we about? You know, as I said, I opened my practice about, a little over 4 years ago. And after doing that, I said to myself, this is the best thing that I have ever done professionally. And every pediatrician should have access to being able to practice medicine in this way. But then I said, well, not everyone has the luxury of understanding business or wanting to do business or having, or even, whether it's the background things or even sort of how do I even get started in the first place, and how do I fund this, and where does that all come from? And so sort of giving, as Drew said, decreasing the barriers to entry and allowing doctors to be part of this model that wouldn't necessarily be able to sort of take that leap independently. As much as I think every child should have access to this model, I think every pediatrician should have access to this model too. And so, we have sort of, you can see the 5 things listed here that doctors can really be the pediatricians that you want. You can do what you love. You can be the doctor that you dreamed without having to do all the things that get you into the DPC model to start with. We also provide for sort of a really quite a team approach. One of the beauties of being in DPC medicine is that you're independent and you have autonomy and you can do what you want to do. And so that for me was one of the biggest things that I wanted when I started my practice and was insistent upon maintaining within the Zest model. And so we have sort of set this up in a way where doctors, in our opinion, sort of have the best of both worlds, where they really are able to run their practices and do all of the medicine that they want in the way that they want to do it and how they want to organize their time and their schedules and how they want to see their patients. And then in the background, we've created this team. So I guess there's sort of 2 teams to our model. One team is from the business side, that we sort of just do all that back office stuff. It frees you up to allow the physicians to be able to practice medicine, just basically be doctors and not have to be business people too. And then the other part of the team is that you're not doing it sole, which means that we have coverage. So our doctors cover for each other. All of our Cleveland doctors provide coverage for each other, so we can actually take vacations and do things much more easily. I know other DPC doctors figured out we're all very innovative and we sort of learn how to manage those types of things, but having a built-in coverage system definitely makes it easier. And your kids are all going to be taken care of in the best way by other doctors who think and practice medicine like you do. So that helps. And, same thing with our Pittsburgh doctors, they're able to cover for each other. And so we love that part of it. And then also from our team approach, we have, because of being this network and that we have, as I say, kind of economies of scale, we are able to provide what we call our ZAP services, which is the sort of additional professionals that work with us. So we have a nutritionist, we have a sleep consultant, we have a lactation consultant, we have psychologists. So we're all the kind of extra people that I feel like are very important and we feel like are very important to be part of raising a kid and really providing really excellent primary care services. I will be the first to admit that I am not all of those people. I am not a lactation consultant. I am not a sleep specialist. I know a lot about it, but I'm sure not the absolute expert in that. And so we really wanted to not only surround our doctors with a business team, but also with this extra sort of support team to really be able to provide the best care that we can. And so, the other benefits, as you can see here, I sort of described our model and sort of how we feel like this is kind of a transformational way of being able to not be part of a large system, but also not be totally alone out there in the world. And then developing in such a way that the doctors can actually have equity in Zest. We recognize that they are part of our team. They're a part of developing all of this. And we want to include them in sort of the equity that comes with being a Zest, part of the Zest team. And then it also, allows for you to have time to do lots of other things. And I think that's one of the things that many DPC doctors really enjoy, is that their time can be their own once we sort of get past the how is it that I'm on call all the time? But then it frees up a lot of time, especially in our model, of not needing to worry about all the business things. You have a lot of extra time that you're not sitting and going through all your finances and trying to sort all those things out and meeting with your accountant and doing all of that comes along with running your own business. So we sort of free up the time for that too.
Yeah, I have a few things that I love about what you said. I think that not having coverage is definitely one of the big pain points of solo DPC docs. We get that in the Facebook groups all the time of like, what do you do when you have to take a vacation, or when, you want to go to a conference like the mastermind that's coming up? And that's a hard one. When my first year, when I was by myself, that was the hard one. And then I think this is a beautiful way of teaming up. There are lots of ways to do it, but this is a great way of doing that. And I like that you're really able to offer those sort of accessory services too, like the lactation consulting and other things, because really when you talk about going from the fee-for-service world to the DPC world, you become so much smaller and your panel becomes so much smaller. So for one person with a panel of 250 to 400 patients to be able to actually hire someone like that is not really feasible. So yeah, fantastic.
Exactly. Yeah, that was one of our main drivers there, as we said, how can we actually get all these people? And by sharing them amongst multiple offices, it actually allows us to do that in a way that works for everybody. It's great.
Exactly why we created the model that we did. And Keili talked a lot about our team. Our team is about 15, 16 people now, between the doctors, our clinical support professionals, as we call all those hub and spoke people, or our ZAPs, and then some of the business things that we do. So all the things you see here, we've now done through our 5 offices, 3 in Cleveland and 2 in Pittsburgh. So we can set up a practice pretty darn quick. The last one we opened, it was 3 months from the time the doctor said, hey, I want to join you, until she was in this model seeing patients. And it was those 3 months because that was her notice period for her practice. So it's pretty quick. And you'll see in a little minute, Keili will mention, or I'll mention a little bit later, that we really manage everything for the doctors. They're busy enough having 2 full-time jobs, being a parent or a spouse and being a pediatrician. So we kind of take that 3rd full-time job of being a business owner, and we do that for them. We help them with everything. They show up and they just are the doctor in the DPC model. See all these things that we do. And last thing you were talking about was the clinical coverage and the support from these clinical support professionals. And everybody's on one EMR. Everybody signs the same agreement such that they can share patient information. There's no HIPAA issues. We really function as a network, so the lactation consultant can go into our charts and get the patient's weights.
Nice.
They can get information on the family, same with the parent coach or the psychologist. It's really a network.
Yeah. So when I see this slide, I'll be completely honest. It makes me think of the fee-for-service world. And for some people, it might trigger feelings of like, oh my gosh, you're doing all this stuff. Does that mean you're also going to take 70% of my collections like the fee-for-service world does? So I'm sure you'll get to that.
No, it's a great question. And we have a very thoughtful approach. It took a year for us to create, intentionally, because we did not want to become the man. We did not want to become a corporate healthcare system. And that's why each doctor is their own LLC. We work for the doctors. The doctors don't work for us. We do not employ any doctors.
Gotcha.
And all these professionals, the clinical support, they contract with us. We don't employ them either. So they're their own LLCs. So that is one way that we have our thoughtful approach to not becoming the man, is that we work for them in a servant leadership way. At the center of our ecosystem are the physicians and their families, and that they're all in their own LLC. And with that, we do what every other DPC pediatrician is doing: high quality care, access, empowering parents. But in addition to that, we have a bigger view of what we want to create, and that is add these clinical support professionals, and we're going to continue to add other ones with time. And then we want to integrate with the community as best as we can. We are about to sign our third contract with school organizations. We have contracts with Medicaid, as you know, that we do through the network that the doctors can join. We just signed another contract this week to do autism assessments for a Medicaid plan. We already have contracts to do autism evaluations with, I think, 7 therapy centers. So there's a lot a network can bring. Doctors can do this on their own. You and I all know people, we've heard stories from all of our DPC friends who have done it, but they're reinventing the wheel every time, then coming into a network as their own LLC, but coming to a network and collaborating across this ecosystem. So this is our whole vision. We're proud of having created it, but we are extremely cautious of what you said about not becoming corporate health, not becoming what people are running away from.
Yeah.
And truly, as I mentioned, I think it's the autonomy is one of the most beautiful parts of being a DPC doc and being able to have all of that. And so, that in my mind is always sort of front. That is the thing that I'm always sort of evaluating when we think about what are we going to do next and how we're making decisions. It is maintaining autonomy for our physicians so that they feel like they have say and they do how they run their practice, how they want to run their practice.
Got it. So I'm curious how the risk gets sort of distributed, because obviously the doctor is their own LLC, but also you're kind of on the back end supporting. And going into DPC is a risky thing, right? I think all of us who have done it know that, like, I don't know if it's going to take me 6 years to get full or 3 years to get full. What am I going to do in that intervening time? How am I going to support myself and my family if you're the primary breadwinner? Then I definitely thought about all those things going into it and just sort of praying and like doing my best, but also please let this work. So how does the risk work?
So in a couple of different ways. So, and I guess this slide actually answers some of that question. One of the things that we do and we have the ability to do within the network is we get the doctors off the ground. We set everything up for them and we assume all of that risk ourselves as far as, the initial cost of setting up a practice, negotiating the leases. We take on the risk of having a lease at all and we own that. And so everything that you sort of need to get started, and we do all of that for them. And so they're certainly involved in the process of doing it, but all the risk portions of that are things that we assume as a network. Doctors are essentially signing on to practice with us, but yet we allow it such that if it is not working for them and they decide that they don't want to be a part of it anymore, that they can exit and we still have all of the risk. And so we're really actually eliminating that from the equation at all for most people. And so certainly there's the whether or not, depending on how fast your practice grows, and, there's not, the risk is still there of the growth factor of it, because that's going to exist no matter what you do. But as far as if you've invested all this money and time and resources into things, that part of it does actually not exist for our patients, for our family doctors. And then the other thing that I think Drew kind of alluded to with some of the contracts that we have worked very hard to help doctors have some side revenue while their practices are growing. And I'll let Drew speak to that, but it has helped our doctors to be more successful and not have to carry that burden of sort of the salary loss that often comes with becoming a DPC doctor.
Great. I'd love to hear more about that.
Well, as I mentioned, a lot of that is in autism work. As you well know, Marina, the doctors in DPC have more time, and part of the things that they can do is autism assessments, and they find it extremely valuable to assist therapy centers and families, or I should say they find it extremely rewarding to do that work. And need for it, and you can get money off of that. So we have helped them earn those side gigs money in that way. We'll help them look for medical directorship jobs, help them set up community vaccine clinics if that's what they want to do. There are many ways to get alternative money other than just membership, and we're here to help them as they want to do it. They may also pursue other side gigs on their own, working in urgent care somewhere, but we will help them do it if they want to do it through us. You have to
Mhm.
remember, in this model, we're all in it together. Their success is everyone's success. And so
Mhm.
we want them to success. That's why we lower the barriers. We pay for all the upfront expenses, and we take away all the risk other than going into a new model of care.
Uh-huh. Gotcha. So how
Yeah,
does compensation work given that, the person is their own LLC? How do the finances work? If I wanted to go, if I went to you and said, I want to do it under your umbrella, how's it going to work financially?
we would say to you, we're going to set everything up. We're
Hmm.
going to cover all your initial expenses
Yeah.
to get you up and running. And then there's a network overhead charge to them, which is a percentage of their revenue. It's not a flat fee.
Uh-huh.
And so as they grow, the percentage stays the same, but then they pay us money and basically are paying back us for all the services that they get. All the IT, all of the accounting, the bookkeeping, the ZAPs, which are the Zest additional professional services, are part of that overhead.
Hmm.
Everything is part of the overhead. And it's really a partnership is what it becomes. We're helping them get started, and then they start to pay back for part of that membership.
Hmm. Gotcha. And the Zaps, how does that work financially? So is the membership that a family is paying covering also those accessory services, or is that extra?
There's Zaps and there's Zaps Plus because nothing is simple for you, Marina.
Gotcha.
We feel strongly that parents deserve and need a certain level of lactation, sleep, nutrition, parent
Yeah.
coaching, like psychological. So all of that is included in their membership to a certain extent. If they want ongoing longitudinal support with any of those specialists,
Mm.
then they pay extra for that. It's all run through Zest. Again, the doctors aren't worrying about the billing or the organizing of that. They're
Yeah.
simply worried about high level, concierge level
Communication. Coordination.
integration, referrals, assisting on that level. Uh, we really felt that was part of it. We also feel this is one of the ways we differentiate ourselves from family medicine providers. I wanted to say other providers, but it's really the family medicine who their fees for kids are much less. And we feel between the home visits, which we all do, the vaccines for kids, we all do, but our members are getting these wraparound services, which is a much more holistic approach than people may be able to get from a family medicine DPC doc.
Hmm. Gotcha.
Anything else you were hoping to learn about
Uh-huh.
the network that we didn't tell you in this short time?
Well, if you're willing to share, like what kind of percentage, because I think a lot of people will wonder that going into it.
Rather really tell them one-on-one because
Okay.
give you the percentage, but not for you to completely understand what all that covers.
Yeah.
Is where we have a gap sometimes
Uh-huh.
because that percentage covers virtually all your expenses except what's variable at your location. So your rent, your malpractice, and your monthly supplies.
Hmm.
Everything else we cover for you. So they don't pay a cent for their IT, their marketing, their accounting, their websites, their
Hmm.
social media, their contracting, anything else
Yeah.
that is
And
done.
that's a lot. I mean, I will say that as much as sometimes it can be like, well, I don't want someone to be taking a percentage. I think lots of people underestimate the amount that it really costs to do all those things. I, having done it myself, and as I grow, also those expenses become more and more. I've realized that the reality of a business is like you have to spend money to make money, and all of those back end things. I mean, I'm paying 1,200 every quarter for just my bookkeeping and and sometimes legal fees are 200 to 400 an hour, and marketing can be expensive, and website design can be really expensive. So it is a lot of value that you're bringing, and I think sometimes we don't realize, especially I think there are a lot of stories that people post on online groups that are like, oh, I started my DPC for only $10,000 or only $5,000 and I'm going really lean. And yes, some people can do that. I think sometimes maybe they're not. I mean, it's something related to preference, but also some people are willing to take more risks and go without certain things, and some people are more risk averse. And so all of that factors in. I think all of that, everything you listed, it really does add up to a lot that they're getting.
As you know, in your talk you gave last year at Mastermind, and you'll give again this year on different models and budgets, the budget can go for a brick and mortar from, 20 to 40,000 just for your supplies.
Mm-hmm.
And we've really tried to ascertain, well, what about all these other costs? And it really gets up to 80, 85,000, if not more, when you add in your marketing, your social media, your website, your accounting, your legal fees, your
Mm-hmm.
lease negotiations, building out your equipment. Well, I guess that's part of your 20 to 40 and your estimate, depending
Yeah.
on. I love the way you have 3 different levels of startup.
Oh, like the startup costs. Yeah. My estimate was between that kind of like, if it's really like basic, maybe home visits, maybe you can get away with 15,000. But really, if you want brick and mortar and you want more of the bells and whistles, we're looking at more like 40,000, like you're saying.
Yeah. And then you add in all the other things. It adds up quickly over your first year.
Yeah, definitely.
And that's why we want to lower the barrier. And so it's not only financial risk, but it's also those that just don't want to run their own business or don't want to have to make all the decisions. You've seen the Facebook group is incredibly collaborative,
Yeah.
but you're asking a lot of strangers, a lot of different people for your
Yeah.
advice. You're getting all kinds of opinions.
Yes.
Whereas now with our doctors, we've done it 5 times and we
Yeah.
have 5 going in our 5th year of experience to answer those questions.
Yeah, gotcha. I'm curious. So what would happen, or what does it look like working with you if, let's say, you're not very quick to grow? So I'm sure that there are some of your physicians who have been pretty quick to fill their panels. I don't know if there has been anyone who's been slower. So what does the doctor do if they have slower growth?
Well, we really try to work with each person sort of on an individual level and recognizing that every environment and region is going to be a little bit different and how they're going to grow. I think overall, we're very flexible in sort of how do we how do we help them? In part is we'll continue, and for some doctors, we may extend the period of time that we are sort of covering all of their costs until they get to a point where they're able to start supporting themselves more and more. And we want to really remove a lot of that stress. Like, we don't want them to feel like if I don't get to, X number of patients by this deadline, then like my practice is going to blow up and I'm going to have to quit this model. We don't do anything like that. There's very much of like, we work with you. We are constantly trying to brainstorm with our doctors of how can they help their panels to grow? How do they network? What resources have we found that have been particularly useful to use? We sit down with them on a regular basis and kind of talk through, what are you doing? Like, what things can we change? What can we tweak? Who have you talked to? Like, what avenues have you tried to get patients, or where are they coming from? How to do all of that stuff, which for most doctors does not come naturally. As much as we're not business people, we are also not marketing experts. And so sort of learning how to work the field in that way and to sort of grow practice in that way is something that we definitely have put a lot of energy into and have worked with a lot of extra professionals out there, marketing professionals and people that we are really trying to help hone in on, like, what is the best way to help grow a practice, and then giving that to our doctors to allow them to use all of those areas. We also support them sort of with like the extra side gigs and the autism stuff, and kind of give them ways to help keep them afloat from their families so they don't have that extra stressor as they're continuing to grow, knowing that everyone's going to be a little bit different as they grow.
What I can tell you from a business standpoint, to answer your question, nobody has yet paid us money that they haven't earned in their practice. So nobody has to go into their savings unless they're doing that for, living expenses like anybody who starts a company. But their success is our success. And so I think one doctor went negative one month, but we floated that. And so nobody has had to pay us money. It's just not the model that we're going for. Nobody has had to put up any upfront money for their practices.
Gotcha. Yeah. Do you think there's a certain type of maybe like personality or profile that this model would be better for? Because like I said, personalities are all across the board, and some people really want to have control over everything, and some people are like, please hold my hand, I don't want to do a lot of the back end stuff. What would you say? What questions can people ask themselves to really find out if this would potentially be a good fit for them?
Just what you said. Do they want the added stress or excitement, depends who you are, to run everything yourself? And if you find running everything yourself from scratch is exciting then super, go for it, including the coverage and including the angst of, finding the patients, and that's fine. We talk to people all the time who want to do it themselves, and we're here to support the whole movement. But if you're somebody who doesn't want to run your own company, doesn't want to learn how to do your own bookkeeping or hire a bookkeeper, whichever it might be, then we're perfect for you.
Excellent.
You want to answer that any other way, Keili?
No, I don't think so. I think that, that really sort of is sort of where the split comes. There are people who are incredibly entrepreneurial, myself being one of them, right? I obviously did this all on my own, and I learned all the things, and I recognize how hard that was. And so I don't want to make everybody else do that. So for those types of people, like, I am thrilled that they want to be part of the DPC movement so that we can all grow and this can become an entity that is everywhere and that kids have access to everywhere. So I think we fully support people who really do want to do it on their own and are growing in that way. And then there, as you all have said, it's just they're the ones who just don't want to take all the risk and put up and have to do everything on their own. This is gives them an opportunity to still do it. And that's who we're looking for.
You can go back to the team analogy if you want. There's some people who want to do a non-team sport, want to play chess or maybe singles tennis. And then there's people who want to be part of a team as well and feel that they have that support and that camaraderie. So that's another part of the personality you have to think about is, do you want to be a part of a team or not? And back to your excellent point earlier, Marina, we are very cognizant that we do not want to become a corporate healthcare. And we have those conversations all the time about how can we continue to support the growth of the doctors without becoming a corporate healthcare team.
Yeah. Speaking of that, so one of the things that some DPC docs really like about DPC is that they get to really personalize their practice. Are there more constraints in terms of personalization within your umbrella of Zest Pediatric Network? So, for example, some people really like doing home visits and they want to focus on a home visit model, or some people really want to do more integrative or lifestyle medicine. How does that fit within your model?
I would say that we are very open to allowing the doctors to sort of do whatever it is that they want to do as far as how they're practicing medicine, provided that it is evidence-based medicine and we are not doing harm to children and all of those sorts of things that we kind of take for granted, but is important. We always have a culture fit when we talk to our doctors to make sure that those are also things that are important to them. Then outside of that, if you are interested in integrative medicine, like myself, I'm currently getting a fellowship in integrative medicine,
Nice.
and I will use that in my practice once I have that knowledge base. If our doctors want to do a home visit for every single visit, and they can figure out how to make that work within their time constraints, go for it. And so in that way, we really give them lots and lots and lots of freedom as far as how that they want to practice and how they do their schedules and when they're in the office and what their hours are and if they come on weekends or if they don't. It's important that they're available and their patients, feel that in the way that DPC is. And so certainly we give them that. They can't come in and say, I'm only going to see patients from 10 to noon, 2 days a week, and all the rest of the time you have to go to urgent care, right? That's not what it's not that sort of flexibility, but otherwise within the sort of the DPC, feel that we all take on, we give them a lot of freedom that way. Some of the things we are similar across offices, as Drew mentioned, we are all on the same EMR, and that allows us to be able to cross cover for each other very easily and have everyone in the system. So that way it's very cohesive in that way. All of our vaccines are set up the same way. We have contracts with, various vendors and things that allow us to get our supplies and things at discounted rates. And so those things are sort of set up and established. So those things are consistent across all of the offices, but otherwise, as far as how you're practicing, the offices look sort of similar and sort of different. We have sort of a general feel that we have, but then as far as like decorating your office, whatever, be my guest, you can have whatever theme you want to have in your office. And so we certainly allow that and encourage it, in fact.
You mentioned EMR and vaccines. I'm wondering which EMR you use and what vaccine solution.
We're on Serbo. We have a Hint Serbo Spruce stack. Gotcha. And VaxCare is our solution.
Gotcha. Excellent.
We also have relationships with one local pharmacy. The VaxCare is not contracted.
Oh, nice.
People do, and we can get the vaccines through that pharmacy if they're not on VaxCare. And our third vaccine solution, because there is one company which is not even with that. The Cleveland Clinic is not with VaxCare. The Cleveland Clinic is not with this pharmacy. So we have an arrangement with a independent practice to see Cleveland Clinic patients to get their vaccines on one side of town. Actually, on the other side of town, Keili has a relationship to get vaccines in another way.
Uh-huh. Gotcha.
So,
Yeah. Speaking of sides of town, so are you only in Ohio currently, or are you spreading out? Like, who would be eligible to join your network? Where do they have to live?
anywhere. They can live anywhere. So right now, our offices, we have 3 offices in Cleveland and 2 offices in Pittsburgh. And so we have those where the 5 are currently. We are open though to essentially having practices anywhere. It's really a matter of finding the right doctor. And so kind of finding someone who fits our culture and also values sort of what we have to offer. And if those things come together, then we'll open an office anywhere that we have that opportunity.
Excellent. Very nice. You alluded earlier to schedules and to the flexibility of schedules. I think that's something that's really important, especially for a lot of pediatricians who are still raising children and trying to wear the hats of parent and physician. So what are the typical schedules of the physicians that you currently have? Are they Monday through Friday in the office, or are they 3 to 4 day weeks? Sorry, 3 to 4 days a week?
Whatever, they're anything. Like my schedule, for example, is different every single day. Like I do not have set office hours. I will sort of come and go as I need to for my patient panel.
Yeah.
And every single day will look different. And that's so that I can be in lots of different places, that I can go to my daughter's events and I can pick her up from school and I can do things. And so that's just sort of, it really truly is whenever people need to be there. We have the expectation that they will see their patients when they need to see their patients, but are not prescriptive beyond that. I come in on the weekends because it's easier and that's what works for me. But we don't have a requirement that you have to do it one way or the other. It's sort of, we have the requirement that you take excellent care of your patients and your families and you see them when they need to be seen. And as long as you are doing that, then if you want to see them at 6 a.m. or 9 p.m. or noon or whatever, that is your prerogative.
Yeah. And then what about the coverage? So you mentioned that you have other docs that can cover for you, but what are the limitations on that coverage? So obviously if you were going on a vacation or to a conference, but what about, I know there are some people who, team up with another physician so they can say like, I'm only going to take after hours messages on these days and you're going to take after hours messages on these days. Does anyone make those sorts of arrangements, or is every physician a little more independent in terms of dealing with that?
So far, they are mostly independent. We're very equitable when it comes to taking time off and the amount of time that everyone's kind of away. And we just sort of work it out amongst each other of how does that work. We haven't had any doctors specifically that want to sort of bounce their after hours, coverage between each other. But if they do, fine. If there's another physician in the network that they would like to do that with and that works for everybody, then there's no reason why that couldn't happen.
Yeah. Excellent. We were talking about panels earlier, and I was curious, the physicians in your network so far, what's kind of the average size goal panel that they have? So obviously that's going to vary based on home visits, but because you are fronting some of the money and taking a percentage, I imagine you don't want necessarily people with only 50 people on their panel as much as maybe like a more average number. I'm curious.
When we talk to the doctors about this, the goal for all of our doctors are 300 patients in the panel.
Okay.
Some have less. Probably people won't have more. Some may have less. The doctors can also make their own decisions on the sliding scales they want for families. As we mentioned, we do have Medicaid patients, some who pay cash and some who are part of our contract with a Medicaid plan. So again, they set their own rules up. Yes, we want them to have enough patients for us to continue to support all the services, absolutely. But once they get to the point where they're supporting the services, it's really, we want them to be happy. Their success is our success.
Mm-hmm. Excellent.
Yeah, we have not sort of set any established lower limits of you have to have this many patients, but more on sort of the upper end of don't have too many patients that you can't take care of them like you need to. So when that limit is arising, and we sort of are basing that 300-ish number on what I think is typical for most of us. And we feel like we're full, and when we feel like if you take too many more, then you're going to be a little too full. So that's sort of where that comes from.
Yeah, that's it. Yeah, from the numbers I've run, 250 to 300 seems like a very reasonable, unless you're doing only home visits, in which case that's kind of a different ballgame. But yeah. One more question. So what's the minimum commitment? I mean, you're fronting a lot of money, like we talked about, to help someone open up. And so if I signed up and it was 6 months later, said, never mind, this isn't for me, like obviously that puts you in a bad position. So there has to be something in place. I'm curious about that.
There actually isn't, believe it or not. Again, we really want to support the doctors, and if it's not right for them, then it's not right for them. That's part of the risk we're taking. It's part of the evaluation that goes into the geographic area that we want to support, because we have to be cognizant that if it doesn't work out, if a spouse gets a job somewhere else and they have to move, we have to be able to fill that office again.
Yeah.
So it's part of our risk assessment when we decide on where we want to open offices. And so far it's been into fairly large cities, not huge cities, but large enough that we could find another doctor if we needed to.
Makes sense. Excellent. Well, it sounds like a fantastic thing that you have here. Bravo for getting it set up, because that must have been a lot of work. Just like starting up a DPC is a lot of work. You've kind of gone the next level of starting up a DPC network. So thank you for sharing about it and answering all my questions. And how do people reach out to you if they're interested?
Our website is the best way to get in touch with us. Zestpeds, dstpeds.com. Our numbers are on there. They can contact us. Easy. Anyway, Facebook.
Excellent.
Instagram, we're there.
Excellent. All right. Well, thank you so much again. And again, check out zestpeds.com if you're interested.
Thank you. Thanks so much. This was great fun.
Thank you, Marina.
Thanks.